Hi, I'm Gary Bebow, CEO of WRHS Health System, and this is my August CEO Connection. Today I'm really pleased to have with me Dr. Mark Wright, who's a vascular surgeon who joined the WRHS Medical Center staff in March of this year. And so, vascular surgery was a specialty we hadn't had before, and all of us have been really looking forward to having Mark join us. And so, prior to coming to Batesville, Dr. Wright was in Jonesboro, and actually he was a classmate of Dr. David Yarnell, who's on the staff as a general surgeon. And so I know during the interview process, Dr. Yarnell and Dr. Wright talked repeatedly about what great friends they were in school, and so we're really pleased to have you here. And,
it's good to be
and
here.
So you've been here for about, 4 months now, and
something like that.
And so you work over at the WRHS Medical Center Surgery Clinic.
Correct.
Along with Dr. Yarnell and a host of other surgeons.
Right.
And so far, how's it been going so far?
It's been going good. We're getting busier and getting to do a lot of vascular surgery and hopefully bringing some new stuff to Batesville that hasn't been done before.
You know, in comparison to general surgery, I know you had a couple more years of fellowship training. That basically,
right.
what kind of surgery in advance of general do you do?
Well, the real reason I went into vascular surgery was to learn a new skill. If you do a colorectal fellowship, you're basically doing more of the same. But with vascular, I learned a new skill of using wires and catheters or balloons and stents and that kind of thing, and doing the combination of either just wires, catheters, stents, balloons, or just open bypass, or putting it together and doing the combination of those two things. And you don't get that skill in a general surgery residency.
You take call for general surgery, but for the most of the part, your practice is really made up of vascular work.
Right, and that's the goal.
Yeah, and along with you, you brought Farah with you,
Right.
your nurse that worked with you for the 4 years or so over in Jonesboro, and so
Right.
it's good to have her aboard.
She's made the transition much easier.
Yeah, it's the size of our hospital. It's just good to have specialists like you to be a part of us, and it really rounds out our services. Are you going to be involved at all in the residency program at all, Doc? Do you see a role that you can play there as part of the faculty?
The internal medicine or AHEC
yeah.
or is there going to be a general surgery?
Well, there'll be an internal medicine initially, but will any of those kids
sure, I'd
do
like
some
to
work with you?
I think vascular surgery or vascular disease is, in general, a gap in medical knowledge. It's not that hard, but people just don't think about it. And I think it's important for primary care physicians and internal medicine doctors to think of that too when somebody has leg pain or something else.
Well, we're really glad to have you here on staff, and we look forward to having you many years to come, and hope that you're proud to be here as well.
I appreciate it. Thanks.
Thank you. In August, we have 2 employees of the month that I want to recognize. At Stone County Medical Center, Randy Killiam was selected as Employee of the Month. I've known Randy ever since the acquisition of Stone County Medical Center, and when they first came on board, Randy was the head of the respiratory therapy department, and over the years I've gotten to know him and found that he's always eager to help out and really be a team player over in the Mountain View area. So congratulations to Randy. He's really well deserved of that. In Batesville, Josh McIntosh, an emergency room nurse, was selected as Employee of the Month for demeanor. Over the years, I've had so many patient comments about the favorable care that Josh provided in the emergency room, and just couldn't say enough good things about Josh and his interpersonal skills. So when you think about demeanor, Josh was a great selection. And so if you see Randy and Josh during this next month, be sure to recognize them and congratulate them on their much deserved recognition. During this month, we have 4 new providers joining the staff. Stacy Gibson is a MD that's a family medicine doctor who will be joining Robin Kerr at the WRHS Family Practice on Harrison Street. Anitza Cachado is a physician who will be joining our hospitalist program along with Dr. Villagra and the rest of the hospitalists up there. So be sure to welcome Dr. Cajado to be a part of the hospitalist staff. Catherine Applegate is a physician who was an OB/GYN joining the women's clinic, along with Doctors Carlton, Taylor, and Knott. And so we're looking forward to having Dr. Applegate join us. And finally, Dr. Sennell is an MD that's a family medicine doctor who will be joining the Hardy Medical Clinic at WRHS Medical Complex in Cherokee Village. All four of these physicians, we've really been looking forward to having them join the staff. And so if you see them around, be sure to welcome them. Each month, Waiver Medical Center hosts a community health education event in the Joseph A. Ray Rogers Center for Women in Imaging. On August 9th, Robert Walton will be making a presentation on managing blood pressure. So if you're available at noon on August 9th, come on over and listen to Dr. Walton's presentation. You know, for many years, Dr. Walton served as an internal medicine private practitioner, and just the last year or so, he joined our hospitalist group. So I know Dr. Walton's very well respected in our community, and I know that you'll really benefit from hearing his presentation. I'm pleased to report that Batesville Family Practice has been acquired by Waiver Medical Center as part of our system. Doctors Allen, Fielder, Waldrop, Rouillet, R.V. Baker, and Davidson are now employees of the hospital, along with the staff from the Batesville Family Practice. So that all took place effective July 5th, and so if you see them, be sure to welcome them on to be a part of this of our employment group. So thanks for listening today, and if you have any suggestions how I can improve the monthly CEO connection, be sure to let us know. So have a nice one.